Yeah.
Okay, so what we're doing at the moment is we're going to motion out the spine, so in the neck area, and the patient,
that would be me,
is reporting if there's anything that's tender
and it's all tender through here.
throughout the spine.
It really hurts.
So we're just going to palpate, and with our hands, that's palpation, just means the chiropractor will feel for the areas in the vicinity that are tight, so where the joints aren't moving. Just get a little stretch, and across this way. And we'll get you to lie on your back. And so the adjustment part is just a high velocity, low amplitude thrust, and it's administered through the direction of restriction through the joint, and we just take the neck into a certain position and we just get a little pop, and that should hopefully feel like it's freed it up a little bit.
Could you feel that? I
Yeah.
mean, could you hear that?
Just
I heard it.
good. Relax the head, tell me if that's enough of a stretch.
Second.
Alright, we'll now get you to turn onto your side and we'll look at that lower back. So the area that's stuck in there, so if you face... Alright, so if you would want to come over just so you can see how I'm contacting on the back. And all it is again is a high velocity, low amplitude thrust. It's a very small depth. We take the patient into what's called a lockout, and we just go gently, and
Nothing happened.
we'll maybe just get the tension a bit. So just take a breath in and out of the way. And a little bit of a pop. Okay, we now get you to turn onto your front. We'll check through the mid-back, so face down. And again, we'll motion out chiropractic just to feel if there are any restrictions, and ask the patient if there's any tenderness at all. We go through the spine.
It's all tender.
So all tender through
Ow,
there,
that one hurt back
and a little
there.
bit through here.
What's
So
that?
we'll do a trigger point on this muscle.
Yeah.
Just hold that for 10. The knots appear in the muscle, and if we can press on them with enough pressure, it will dissipate the tension, and tension dies down, and the muscle spasm will die down as well. So we'll do another adjustment through the mid-thoracic spine here, where the joint's a little bit stuck. So get you to take a breath in and breathe out. Well done. And then we'll get you to take a seat, please, facing the opposite way. So that way. Okay, we'll recheck the movements now, so we'll just check out the spine again. Check for restrictions. So get you to turn your head as far right and as far left now as you can. And your head, cross the arms over the shoulders. Just check the middle of the back. And the opposite way. And then to the left. And then to the right. Okay, so we'll do the soft tissue work in a second. You can rest your arms down. So with this particular patient, we've increased the movement in the spine and the neck, in the mid-thoracic area, so the mid-back, and in the lumbar spine.